Thank you, Andy, and thanks everyone for attending today's webinar, Don't Land in Hot Water, Audit-Proof Your Coding and Documentation. So today we'll discuss the government aspects involved in audits. We'll talk about RAC, CERT, and OIG, and how these programs work and some of the areas of concern. We'll also discuss both internal and external audits. You'll learn how both internal and external audits can identify areas for improvement in documentation, point out billing, corrections that need to be made, crack down on insufficient provider documentation, and help to avoid undercoding, overcoding, and bad coding habits. We'll also point out some really great resources and tools, including EM Auditor, CCI Edits Checker, CMS 1500 Scrubber, and CCI Consulting and Revenue Cycle Solutions. So let's get started. First, we'll talk about why audits are so very important to the success of your practice's compliance. As payers continue to increase their level of scrutiny, your risk for noncompliance also increases. Auditing can be a huge part of maintaining your practice's compliance and reimbursement. Auditing can be a great asset, and if you find yourselves in the crossfire of a government audit, you'll be able to combat against that. A successful compliance plan will incorporate both internal and external third-party auditing. Before beginning your audits, you'll need to get your staff, all office staff, including physicians, on board. Without their support, you'll struggle to perform the audit, and the results will be fairly meaningless if no one is prepared or willing to act upon them. Once you have convinced the physicians and senior staff of the necessity of the audit, you should then present them with the audit plan to all of the applicable staff members. Explain to everyone in the practice just why an audit will benefit the practice. So first off, completing regular audits is just good practice. You can refer to these audits as reviews to ensure that employees don't hear the word audit and panic. Some may hear the word audit and equate it with finding mistakes and consequences, but reviews are considered more like checkups of your coding and documentation practices. So make sure that you stress the benefits of the audit once again. By doing regular audits, you can identify areas of lost reimbursement, opportunities for education, ideas for better forms or electronic medical record screens, and ways to tune up the practice compliance and processes. In addition, chart audits make it possible to find and correct coding errors and self-report rather than letting the Office of Inspector General, or OIG, or a payer find the results and possibly add fines. There are two types of audits, internal, which is in-house, and external, which is done by a third party. So audits can help ensure proper billing and coding, that the correct reimbursement has been received, and can identify new reimbursement opportunities. Audits also help combat government reviews, payer medical record requests and denials. In addition, audits ensure provider education on documentation requirements, and they help with quality patient care. If documentation is compliant, it will include the necessary information for not only billing, but also serve as a record for planning patient care and for a record for the patient's medical history. Compliant documentation can also help defend against malpractice litigation. So we do know that auditing is not just for coding issues. As I explained, documentation is equally important. This will give both the clinical staff, this is going to involve both your clinical staff and medical providers and physicians. Now here are a few documentation issues that can be easily resolved. Timely documentation. Documentation should be completed at the time of service or shortly thereafter. Now there are certain documentation timelines to maintain compliance, and once again it just helps with good patient care. Some entities specify timelines for timely medical documentation entry in their policies. Timely medical documentation can be crucial for hospitals especially because patients may be undergoing complicated sets of services by different providers. Entries must be timely so that all providers working on the patient can know exactly what has occurred and when. CMS has special guidelines involving signature requirements. including but not limited to the legibility of the signature for handwritten signatures. We should know by now that signature stamps are no longer accepted by CMS. Electronic signatures, they're going to often require the physician to enter a code or log in order to sign the note, which makes it more compliant. When a signature is listed on documentation, this means that the provider has reviewed the documentation and agrees with what has been documented. A date and time must be present for all entries. This allows medical treatment to be reconstructed at a later time. If the time of service and time of chart entry are different, it is appropriate to document why there is a discrepancy. So there are 4 basic types or formats of documentation. You have handwritten, dictated, templates, and electronic. Each format has their own shortfalls, which may cause trouble for your practice. Handwritten documentation is often illegible. Someone not familiar with the practice or provider may not be able to read the documentation. And Medicare will not review documentation that is illegible. They're just not going to waste their time on it. So this means that you'll probably be found at fault for the review and will have to refund money if a solution is not met. There are still a number of providers that do use dictation. And dictation can also pose a problem if the dictation is not clear, efficient, and organized. The transcriptionist should not have to piece the visit together for the provider. And then in addition, it may take several days for the transcriptionist to transcribe the dictation and return it to the provider. The provider must then review it and sign off on the documentation. Now, some providers will find it necessary to enter in a placeholder document just to summarize what occurred until the note is transcribed, reviewed, and signed. Templates, they're used quite often in documentation as well. When using templates, sometimes providers will fail to elaborate when a finding is abnormal. So cloning can be a problem with templates if providers are not adding information and including details about the patient's care and condition. Electronic medical documentation is the most popular with the surge of EMRs. Cloning is a huge issue with EMRs because they allow the provider to bring forward information from previous visits. Now, cloning causes records to appear identical from chart to chart, so providers must remember to indicate that they have reviewed the information and date it if they want to use information from previous visits, such as your review, well, not necessarily your review assistant, but sometimes they'll do the past family medical history, that type of thing they like to bring over. So if they in there that they reviewed it and agreed, nothing changed, that will help that not to appear as cloning. So EMRs also can cause information to be added, templates cause information to be added to documentation that does not pertain to the visit if the provider isn't careful. So once again, adding details and more information in addition to the information in the EMR template can reduce the appearance of cloning. It'll make it look different. EMRs also allow for over-documentation. This may not be consistent with the medical necessity and why the patient is being seen currently. So these issues can be found through regular audits, especially an external or third-party audit. They can easily be corrected with proper education. So now we'll get into some of the different government programs that make auditing so very important. According to CMS, the Recovery Audit Program, or RAC's mission, is to identify and correct Medicare improper payments through the efficient detection and collection of overpayments that have been made on claims of healthcare services provided to Medicare beneficiaries, and to identify underpayments to providers. The goal is to also allow CMS to implement actions that will prevent future improper payments in all 50 states.